Now, to tell you a little bit about Migraine and Headache Australia, our mission is threefold. If you've been attending on the previous nights, you'd be very well versed on what our mission is now, but it's to provide reliable and trustworthy information, like what this week has been about, and from the headache experts that you've seen on the other nights and that we'll have tomorrow. We aim to fund research, and so over the past 11 years, we've funded 8 research projects into migraine or headache. And we advocate and support people living with headache disease. And I'll talk a little bit more about that actually regarding some of the activity we've done recently. And so to speak about some of the activity, each night so far, I've covered one of these elements to highlight one of the activities or some of the activities that Migraine and Headache Australia has been doing. It's been a very busy year. And this year, and this session tonight, I'm going to talk about funding. And so the funding came from the federal budget, but it was a couple of years in the making. And so to share a little bit of information about the backstory to this funding, in 2019, we convened a workshop with a cross multidisciplinary group of stakeholders. We had people, we had scientists, researchers, doctors, nurses, patients, carers. We even had a few journalists that took part. And we held a workshop to develop a strategy for chronic migraine in Australia. And it led to the publication of this strategic action on chronic migraine, which we have available on our website. And we produced this report. We sent the report to every MP in Australia. And we also applied for budget support to address this issue. And a couple of years later, after the initial workshop, we, for the first time ever, received funding that several organizations will be using to educate both professionals and patients. And we're working very closely with the Australian and New Zealand Headache Society to develop resources for them to help train more doctors and healthcare professionals about migraine and headache. And we're also in the process of updating new medically reviewed articles, as well as updating existing information on our website, which is an ongoing effort. So some good news, if you're interested in this report or publication, if you haven't seen it yet, would highly recommend reading it. We can share a link to that in the chat shortly. So are you in the right place? If you have headache or a migraine disorder, if you are a parent, partner, and caregiver, if you'd like to connect with others like yourself, and tonight we are going to be opening up the chat so everyone can interact with each other, I would say please be courteous and polite to your fellow either migraine or headache sufferer. There are a lot of people who have brain fog, who have fatigue, who may not be having a great day, maybe having symptoms, maybe having an attack as we speak. And so please, let's treat everyone with kindness and empathy in our hearts. And if you want to ask questions, now's a good time. Well, this session will be a good time. We'll have Q&A at the end, but feel free to ask your questions throughout the live panel that we have as well. We'll be keeping a list of them as well as asking for more towards the end of the questions. And now, if you'd like to ask a question or to chat, you can see here in the bottom right-hand corner of your screen, there'll be a box where you can select either Q&A mode or chat mode. If you select chat, you'll send a message to the whole group. If you select Q&A, then you can do that as well. And you can also send private messages to the moderators and administrators of the admin as well. So you don't have to send public messages if you're not comfortable. So over to our host for tonight, Stephanie Dalzell. She is a federal political reporter for ABC. She's based in Canberra. She's been with ABC for more than 10 years, and she's particularly passionate about health journalism, draws on her experience and her personal experience of navigating the health system, having had chronic migraine, endometriosis, and brain tumours. We also have a panel with Gabriella Kelly-Davies, who is an author. We also have a business owner with Sarah Orwell, and a journalist and podcaster with Sarah Alili. So without further ado, I'll invite our panel and our host for tonight to join me, and we'll kick it off with a question or an introduction from Stephanie.
Hello, everyone. As Carl said, my name is Dalzell. I'm a political reporter at the ABC, and I specialise, or am particularly interested in health journalism. I happen to suffer from chronic migraines, and as most of you would know, migraines or headaches are incredibly challenging to deal with. They're very complex. So tonight we'll be unpicking that all. We'll be talking about what works for us, what doesn't work for us, and we'll also really encourage you guys to get involved. As Carl said, there's a space for people to write questions. So I'll be talking to the panel for about 40 minutes or so, and we'll leave a space for questions at the end. So it'd be really great to hear from you. So I guess I'll kick this off by asking our panelists about their own experiences. Gabriella, let's start with you. Can you tell us a little bit about what a migraine looks like for you?
Gosh, it starts in so many different ways. It can be gritty eyes. It can be shooting pains up the back of my head, or it could be nausea, or it could just be an ache in the head. And so often it's hard to know that that's a migraine. I think I just try and ignore it. But if I ignore it, then it blows up and sort of explodes an hour or so later.
And what does that explosion look like?
Most of my migraine is in the base of my skull. So it's this incredible pressure and pain in the base of my skull, and a lot of nausea, dizzy, and feeling really, really unwell.
And what about you, Sarah O'Rell? Tell us a little bit about what migraine looks like for you.
Yeah, very similar. I think often I'll just feel a little bit of vertigo, and that's the first sign. I go, oh, something's going to come on, and about an hour later is when I get the worst symptoms. Sometimes it'll be on the left-hand side, sometimes it'll be on the right. There's no rhyme or reason to it, but often it's one or the other, and it very much feels like there's just not enough room in my brain, or in my skull, for my brain, and I feel even the slightest amount of movement it is very nauseating. So nausea, dizziness, often even just extreme fatigue, and just feeling like absolute garbage. So, yeah.
Gabriella mentioned the explosion, which I get as well. Is that something that happens to you as well? And then how often will an attack last?
Yes, actually more and more common is the explosion or the exacerbation of the symptoms. I think it goes from about a 7 to a 9, and then you just can't think straight. You can't do anything. You often I'll just have to go to bed for an hour or so. And, as we know, all different kinds of medications and things, that there's not really anything that can fix it. And often it'll be a few hours until that calms down. I found the best thing to help is go to sleep. As soon as I can just go to sleep and I wake up, it's either worse or it's a little bit better.
Yeah.
Now, Sarah Alalee, your story is a little bit different. It gives us gives me a beacon of hope in that you used to have migraines and you've pretty much managed to significantly reduce those. Can you tell us a little bit about your story? Sarah, I think just unmute your microphone.
Sorry. Yes, I've even not referred to mine as migraines, but more headaches, because I saw migraines as being more like what you three have described. And my headaches were, and if I get a relapse now, are much more short-lived, but sort of I might get like, I used to get a lot in one day, but they would sort of go away and come back, and it was sort of a pressure in the back of my very sort of quite low down back of my base of my skull, and my headaches were very triggered by noise and stimulation and phones, computer use, but really like the mobile phone. And so I had an experience 2015 where I was knocked off my bike and hit by a car and suffered a mild traumatic brain injury. And it took a very long time for that to be diagnosed. And what happened is I I couldn't, I just basically couldn't focus, and the effort of focusing and concentrating on anything, even just, I picked up the novel that I'd been reading before I had the accident, and I literally couldn't understand it. Like, I could run my eyes over the words, but I couldn't understand it. And the pressure of trying to focus would give me a headache. And then I found that just, being around my young children, I couldn't be in a sort of a noisy cafe, or even just a room with multiple people having a conversation, or even just television or the radio, music or anything, would give me these headaches that were quite intense, and they didn't respond to painkillers. And the only thing that I found that they responded to meditation, and also to spending time outside in the natural world. And so I sort of discovered for myself that actually nature was the cure. And I still find now, and I've basically, almost, I would say fully recovered. However, weirdly, in the last couple of weeks, I've had this kind of relapse of getting headaches again, which must have been preparing for this. And I'm finding hearteningly that, again, just going for a walk outside, being in my garden, literally sitting and staring at trees will actually be what will quite quickly get rid of my headaches. And again, finding that using my phone, I can read books, and like my focus, I'm able to. I think the brain injury component of it is recovered, and I can sort of focus on books and listen to podcasts and all of that. But I find that when I have a relapse, what will happen is that I'll be triggered by, the noise of my kids, or just a lot of stimulation, or really particularly using my phone. And so the antidote for that is to go outside and be in the natural world. And there's science around that, and I've done a lot of research around that, and decided to go and make a podcast, 6-part podcast documentary called Brain on Nature. And with that, basically it was me going, okay, well, I've found that there's this magic cure for my headaches, but none of my doctors and specialists have mentioned this, and they're just doing, putting me on the medications, putting Botox into my head, and yet here I am finding this like free, no side effects cure. And so I decided to go and investigate that, and made this Brain on Nature podcast, where I spoke to lots of experts around the world, and found that there's all this science and research being done into why nature is good for our brains and relieves headaches.
And you delve into that in your podcast. Can you give us a little bit of insight now as to some of that science behind why nature is so beneficial for headaches?
Yeah, so there's a few different theories, and one of the most simplest one is the idea of biophilia, which is basically that we evolved in nature. We are part of nature, and so therefore our brains actually just work well in nature. And even, as part of my podcast, at the end of all my treatment, when I stopped having treatment from my neurologist, I interviewed him and asked him and said, okay, this is what I found works, and why do you think that is? And he said, well, look, yeah, I mean, we're hardwired. We evolved in nature. Our brains are not hardwired to work on computers. We actually are. That's what our natural environment is. And then there's more other science around it. There's quite a popular theory called attention restoration theory, and that is the idea that there's two types of attention, and one is directed attention, which is what we're doing now. We're trying to focus on this. We're having to really use our brains to focus on what someone's saying or what we're reading, and that's tiring, and we get exhausted. And then there's this other type of attention, which is called hard fascination, and that's like your phone ringing, a siren going, watching a movie, something where it just grabs your attention, but it's still draining and tiring. And then the opposite of those is what's called soft fascination. And nature seems to be from what the scientists have found, nature is the only soft fascination, and what nature's doing is the opposite of what those other types of things are doing. And it basically, the way it was explained to me by the scientists is that when I sat outside in my back garden and stared up at this tree, it was fascinating. It was interesting enough. It was capturing my attention, but I wasn't having to do any work to be focused. Because it didn't demand all of my attention capacity, I was still able to kind of zone out. And that zoning out is very restful for our brains and allows our headaches to go. It relieves stress. It also encourages creativity. And so for instance, I'll still, working away at home and I'm you get to that point in the day and you're fatiguing or you need a coffee, and actually stepping outside and looking at the trees is actually going to restore your creativity and your energy and your fatigue more than that coffee will. And the science of that is that your brain is actually getting a chance to sort of recharge, but in a way that's natural and that isn't taxing. But you in that process of just being, I think one of the scientists had a line like, you never say, oh, staring at that waterfall is just so tiring, or I'm getting so tired of just sitting here listening to this, because you're not having to focus, but there's still something happening that's interesting and captivating. It's not boring.
Well, that actually brings me to my next question. We always hear prevention is better than cure. That's obviously a preventative measure for you. What about you, Sarah O? Have you found anything that can help stop bringing on a migraine for you?
A couple of things, probably not one to encourage, but definitely caffeine has been like a big helper for me. And that was something that the neurosurgeon and the neurologist recommended, and lucky I'd already been on that train, but that seems to, often will wake up with a headache. It's just pretty much my standard day is wake up in the morning, pretty much takes me about an hour and a half to feel somewhat functional, and then so brain fog until about an hour and a half, and then after that point it's a headache. It's quite a pounding headache. So I do reach for the coffee, and I do reach for, unfortunately, the carbonated drinks, which are probably not ideal, but that seems to help just get me from one point to another and keep. By about midday, I'm pretty well functional. I can go to work. I also have 3 small children, so there's that, and looking after them is always a bit of a challenge. In fact, they've all just decided to join us, so I apologise in advance, everybody, but this is welcome to lockdown. Here we go. This is Gracie, and this is Rocky. Hello. So you can tell why I would get a headache. I might then pass the buck to somebody else, Jack.
Gabriella, what about you? What is have you found anything that can help prevent a migraine from coming on?
Pacing. So if I pace really, really carefully, I can stop migraines from developing. So, but it's very hard. So I write biographies, and I get in the zone early in the morning. I wake up, make a coffee, sit down and start writing, and I get into the zone straight away. And it takes a lot of discipline to stop and to say, right, I'm going to stop after half an hour or an hour and do some exercises. So I'm my worst enemy because I know that pacing works, but I forget. And people say set an alarm, but I'm not that organised. So I think pacing, so writing, say, for an hour, stopping, exercising for 15 minutes, go back to the writing, and then go for a walk. So breaking up the time that I'm sitting at the computer is probably the biggest. I think the other big preventative is avoiding food triggers. And that's seems to be an ever-growing list of things. And so it's identifying the triggers and then avoiding them.
What are some of the foods that can trigger you?
Oh, gosh. So mandarin, banana, pawpaw, preservative, any food with preservative, and food colours, so ham and bacon and all those sorts of foods, and I just wouldn't even touch them.
And when you talk about pacing yourself, can you give us a little bit more detail about what that looks like when you get up from your computer? What do you do?
So I get up and do some exercises and do some yoga. So I start off doing some yoga, and I start off by doing a few little meditations and then do a yoga routine for about 20 minutes. And then I've got some other exercises because I've got a funny back at the moment. So I do some back exercises. So I probably exercise and have a break for half an hour, then go back and work for an hour or an hour and a half. Then my husband and I always go for a walk mid-morning. And so then come back and do another hour or another couple of hours. And then I try and stop and lay down and listen to audiobooks. And I find that I can't sit and read a book now in the afternoon if I've been at my desk all day. So I find that lying down and listening to audiobooks is the best way to sort of pace myself.
And what about treatment? So if you've done all of those things, but you get a migraine, which unfortunately happens to all of us, what type of treatments have you found most useful when the migraine hits?
Zomig and Zofran. So Zomig is a triptan and Zofran is an anti-nausea medication. So I tend to take both because I get a lot of nausea. Meditation also. So I'll lie down and do a meditation for an hour. And then walking does help as well. Not walking up hills or stairs, but just walking on the flat. I find that just sort of loosening up my shoulders and that seems to calm it down a little bit as well. But other times nothing, and it just goes on for 5 or 6 days. So it's very variable. It's hard to come up with a set of rules because the rule seems to change every day.
And what about you, Sarah O? What kind of treatments have you delved into? What have worked? What haven't worked for you?
I've tried the Botox, and I actually found that quite helpful without realizing it. It was actually by accident. I'd heard about it as a potential treatment, but I had a friend and she just said, she does that for a living and she's a nurse, and she said, why don't you give Botox a try? So I had just a couple of injections, and for 6 months I was in remission. Wow. So I'm not kidding. And I had no idea that that's what had been the kind of cause. I'd been on all kind of Diamox, all the different types of medications that they prescribe for my condition. So I have intracranial hypertension. So I get random high pressures and now low pressures because it's draining, and I have a shunt in my head. So I have found that the surgical procedure was helpful, but only for a really short period of time, and the complications of it have been so much to deal with. So I think that quality of life has been a bit of a way up. Do we go down that surgical path? And I'm probably just coming into a phase now where I'm out of remission and having chronic headaches. Have had now the migraines of chronic headaches now for 4 months, and because of the environment we're in, it's really, really hard to get care. So it's been I literally had to get some covert Botox at one point just because I needed some treatment. So that I found helpful to just put my muscles into at least what seems to be a bit of an atrophy that doesn't move them so much. Not driving. So I no longer drive because driving has become so challenging, not just because vision is a bit of an issue sometimes when a headache can come on, it can come on out of nowhere and can come on quite suddenly too. So if that's happening, I often I've just decided no. So I've kind of opted out of that. But moving in the car, I try to avoid motion, which is not great for exercise, but things like yoga, meditation, even just reading a book with my kids or singing a song with them, doing things where there's rhythmic breathing. I found that to be really helpful, as long as it's not increasing my pressure in any way. It's just really subtle, soft movement. I've had to become very careful with myself, and I'm not the kind of individual that's especially careful in general with myself. I just go out with the world like a bull at a gate and crack on with things. And I've found that frankly, just being a little bit more slow, deliberate, careful. I really like that routine you talked about pacing yourself. That's not something as a business owner, as a mum of 3, the multitasking is always and you're never off. Sleep seems to be the only time that I'm turned off, but I'm working on adding in lots more ways of turning off and trying to pace myself over the day. I think that's some really good advice, and I might take that on myself, I think.
And Sarah, you also tried Botox, but it wasn't as effective for you. Can you walk us through some of the things you tried before you discovered that nature is your healing, I guess, treatment?
Yeah, so what was interesting about my journey is that I didn't know that nature had these healing properties, but I was basically self-medicating from the very start because I had to. Like I had a shoulder injury as well, and I didn't know what was going on. Brain injury hadn't been diagnosed. I was on very strong painkillers, and I literally all I could do was sit in my back garden. And I was very fortunate that I had a back garden. I often thought I'm really privileged that I have a backyard, because literally all I could do was sit out there and stare at the trees until I got the confidence to be able to go for a walk and leave the house. And again, so I wasn't consciously thinking, oh, I'm using nature, but it turns out I was. And eventually, it did take some time for the brain injury to be diagnosed and to get referred to a neurologist and all of that. And eventually, when I did, they tried various medications. I was on Periactin, which is like what do you call it? For people take it for like if you get like a kind of allergic reaction to something. But I was on a very high dose, and initially it made me so drowsy, and I gradually worked my dose up. But I was on it for so long, it never did anything. And again, so I was just continuing to self-medicate with nature and sort of up the ante on that. I started going for bushwalks for myself, which I'd never done before. I started just really engaging with the natural world in a way that I hadn't, and spending a lot of time going camping and things. So I was continuing to see neurologists, and then I had a brain injury specialist, rehab specialist. And after the Periactin, they tried an antidepressant that was supposed to have the effect of mitigating headaches. I didn't find it did at all. And then the last thing they tried was Botox, and I had, so many, it was just one session, but many, many injections into my scalp. It was incredibly uncomfortable, and it made my headaches worse. It was terrible. So I didn't try it again. Yeah. And I never, my specialists were supportive of what I was doing. They weren't encouraging. It was obviously that they would always just be like, oh, well, just keep doing what you find is working, but here, try these pills as well. And they never particularly encouraged me or showed that much interest in what I was working through with nature. But it was interesting because when I made the Brain on Nature podcast and I went back and interviewed them, the brain injury specialist, he took the approach that he just thought that, and he said, I'm a big fan of bushwalking as well. I think it's just relaxing. It's like taking the stress away. The neurologist had, in the interim, like in the time since he'd started treating me, he'd actually had a few articles come across his desk that some of the same research that I'd been reading. And so he had started reading it. And I said, I just got to ask you, why did you never suggest this? Like, why did you never, and you didn't particularly encourage it? And he said, look, there's no, I can't go and, that's, I might now tell a patient to have a listen to your podcast and be inspired, but until there's, there's no double-blind placebo test of this stuff, and you can't, So he kind of accepted that what I was doing was, he could see the value and it made sense to him, but he said, I can't ever prescribe that because there's just not, there isn't the proof in the test, and so we have to sort of still keep on this. He was very good about meditation though, so I think there's been a lot more tests around meditation. So he would actually pretty much, I remember once I said, can you actually write that out on a prescription pad so I can say I have to go and meditate.
Gabriella, you mentioned meditation had worked for you. Can you also walk us through, you've tried a lot of things. Can you tell us a little bit about, I guess, your journey, for want of a less cliched word, with migraines, when they started, and some of the different things that you've tried?
Sure. So I was pushed off my bike by some thugs up in Townsville on my 24th birthday, and I landed on my head and rolled down the street on my head, so smashed up my neck. But I was a physiotherapist, and my physio friends at the hospital where I work treated me, and I seemed to be okay. But a few years later, I started getting daily migraines, and I guess because I was a physio, and back in those days, cracking joints, physios were doing a lot of joint cracking. Every time I had a migraine, I'd go to the physio, and they'd manipulate my neck, and it would go. And that was how we treated it for many years. But then that stopped working, and I started to feel more of a neural pain, which is hard to describe. It's hard to describe the difference between a non-neural pain and a neural pain, but I think anyone who has it knows the feeling. And so then I ended up at the pain clinic at Royal North Shore Hospital in 2005. And Professor Michael Cousins suggested two things. One was doing a pain management program. So it was a 3-week in-house pain management program where we went every day, and we learned about chronic pain and the difference between acute and chronic pain and why they need different treatments. And they got us onto an exercise program, but started very, very gently, and gradually, it was really baby steps every time we exercised, just building up a tiny bit every day. And we learned some psychological techniques, so cognitive behaviour therapy techniques, that really helped us to change the way we thought about pain and reacted to pain. So something that I realised through that was that I was very fearful of pain and very fearful of doing things that I suspected might trigger the pain. And so that caused fear, and then that fear and anxiety could generate the migraine. And so I really started to understand the dynamic of our emotions, and people with chronic pain tend to worry more, be more fearful and more pessimistic. And there's a change in the brain, and I've just been working with a scientist on the changes in the brain in people with chronic pain, and there's a physical change in our brains that make us more fearful. Anyway, so I did the pain management program, and that made a huge difference. But Michael also suggested that he implant neurostimulators into the base of my skull. And so the idea there, it's a neurostimulator. They put little electrodes along the greater occipital nerve, and it sends a current through the nerve and helps to block the pain signals. So that was really good at first, but I had 2 big infections, and they were taken out and put back in, and then got infected again, took them out, put them back in. And so there's lots of scar tissue now in the back of my head. And so the electric current can't get through. So then we tried lots of preventatives. Pretty much, I can't remember all the things that we tried. But I ended up on a medication called Sibelium, which isn't freely available in Australia, but my neurologist has been able to get it in for me. And so I had Sibelium and Epilum. And so I never knew if they worked, but if I ran out, I had a massive migraine that just wouldn't go. So I realised that they were having an effect. And then I eventually ended up taking cannabis oil, and it didn't work at first, but over the last 6 months, it's reduced the frequency and the severity of migraines. So it's reduced the number of migraine days and the severity of the migraines. But there's lots of downsides, like, for instance, I can't drive. And it does make it makes it hard to concentrate once I've taken it. So I don't think it's a magic bullet, but it has reduced the pain. So anyway, after I saw Bronwyn Jenkins on Monday night, I made an appointment to see her because she seems to be right across all of the different treatments. And rather than a scattergun approach, I'd really like a systematic approach to how I manage migraine.
And Gabriella, so you've had pain since you were 24. I've only had migraine for about 5 years, but I've dealt with endometriosis since I was a teenager, and I struggle. How do you manage the anxiety? And, you know, in my case, sometimes I feel quite depressed from pain. How do you manage that after having dealt with pain for such a huge part of your life?
I manage it better now than I did in the past. When I was working in the corporate world and, you know, high pressure senior management, I don't think I handled it well at all. I was very, very anxious. And I used to feel a sense of doom a few hours before a migraine started, and that was almost like an aura. I could feel just this darkness descending on me, and I could feel a little engine inside of me speeding up, and it got faster and faster until the migraine started. And in retrospect, that was anxiety. So I think I was, there were several years where I was in a senior management role. It was very, very busy, very demanding, and I don't think I handled the depression and anxiety very well at all. But since then, I've had a lot of counselling. I've learned a lot of psychological techniques. And now I'm retired and I write biographies, as my retirement job. And because I've got more control over my life, and I don't have this same sort of day where I wake up with a migraine and think, how am I going to get through all those meetings and deadlines and pressure? Now I don't have that feeling at all, just because I control how much I do in a day. So it has been I really see it as a process of trial and error. And I encourage anyone who has tried something and it hasn't worked to keep trying, just keep trying until you find the right mix of things for you. So I found that Qigong is very good, and yoga, meditation, and then pacing, all the non-pharmaceutical ways that I've been try and keep things going well.
It's really interesting, because I do think sometimes you try so many things, and in my case, sometimes you feel despair. So that I think that's really good advice, to keep trying. What about you, Sarah O? You have 3 kids. You run your own business. How do you manage the anxiety of feeling a migraine coming on and knowing that you've got all these things to do? That's something that I really personally struggle with.
Yeah, that's a good question, and I think there's probably 2 versions of the answer. The public-facing answer is you crack on with it. The reality is I tend to have to sacrifice a lot. So in reality, I don't deal with it all that well at all. Most days I try to power through. I suffer. I often feel like I suffer in silence, like most of us. And I don't think, unless you have, experienced headache and migraines, it's easy to articulate. It's different for every single one of us. There's obviously comorbidities, there's challenges, there's complications. Every specialist I've seen to date, besides the ones that I finally landed on, I've really had to learn to self-advocate and find the right people who are going to be my team. And that includes, even family, friends, who's on my team, so that when something, not catastrophic, but when something quite bad happens, or, something that complicates things, and, I end up in ED, which happens, it's kind of the standard, okay, well, that's the last weekend, or then we you need the right people there to support you. So I think that having that has been really critical, and that kind of is been about creating this holistic team around me. I totally understand that the divergence of Western, Eastern, or different types of medicine and approaches to this, it can't be done in isolation, in silos. I've learned about the body, I've learned about the brain, I've learned about the links between gut and brain, and, ironically have gut and brain issues. So I feel like by keeping all systems in equilibrium is the challenge I find every day. So in order to do that, it takes a lot. So even just to drink enough water and get enough sleep, not just with a family, but just in general, is hard enough. But yeah, absolutely, adding a family to that, adding pressures of work. And then, I would say I have a very supportive partner and husband, and he is just phenomenal. I call him my carer, because he genuinely ties my shoes when I can't do it myself, and I'm very grateful for that. But that is sometimes a challenge when you're trying to communicate that you're not feeling well, and you get the odd eye roll or something like that, because even to that degree they've lived through the challenges. If you feel that way about it, so they feel that way about it. So I think it's really hard. I think it's not to be underestimated. any kind of chronic pain and any kind of chronic condition, but in particular something that affects the way that you are. And even sometimes I know when I have a migraine, I'm really cranky with the kids, and I hate that. I hate that I'm cranky and I can't just put that aside. So I try really hard to just put that aside, and I find the more I can empty my bucket, my daughter calls it emptying her bucket. She just started in reception this year, so in kindy. And so if my bucket's really full and there's not enough for them, then I get cranky mum. So mum, if you just take a few things out of your bucket, then, you know, so I think often I actually look to my 5-year-old and like, how do I be a bit more like her, who just cracks on with things and, you know, accepts that. I think what's happened this year, sorry to monopolize the discussion, but what's happened for me this year is really an acceptance as opposed to a fight. And I have been fighting and fighting and fighting for a long time, like fighting against the pain, fighting against feeling like this is so unfair, and the frustration and the absolute BS that it is. And you're like, what did I do to deserve this? And then something just happened this year where I just have to accept that this is the way it is, and it's okay. That's just your life. So live it. Don't spend the rest of it fighting against it, or you're never going to end up being able to live it. So it's I think learning to stop seeing my pain as separate from me. And I think, you know, that's something. I'm very early on and embryonic in the phase of that, but I think some of those programs you were talking about would be really interesting to look at about, you know, enabling that assimilation of chronic pain into who I am, as opposed to this separate thing that has happened to me.
Yeah, it's really, really good advice. Time has flown by. I have lots of other questions for you, but might just check in with Carl and see if there are any questions for you guys to answer from the audience.
Yeah, so there's been a couple of questions actually about juggling chronic migraine or chronic headache disorder and working. And I think there was a discussion about that, but Erin was someone who wanted some tips or some guidance from the panel about, like, she's right at the beginning, she's about to begin her career, but she has chronic migraine. What would you say to someone like Erin?
Yeah, well, Sarah, we spoke a little bit about this. You have a incredibly busy job, as do I. I think everyone has really busy jobs. When you were kind of in the grip of your headache disorder, how did you manage work with headaches?
Yeah, so I had to have about 7 months off work after I had my brain injury, and then I had to return to work slowly. And the way that I did that would be I had to sort of work part-time. But then once I was back working my regular 3 days a week at that point, it was funny. I was working at SBS TV in the North Shore of Sydney, and I'd literally never been to the local park. And I discovered that the local park, I could just walk there. And so when I got a headache, I'd actually just go for a walk to the park, and I'd also found a room that I could lock myself in a way to meditate as well. So I did those two things. But I think, a challenge for me is I was very nervous about, I didn't want people to know. I was very worried about how it was going to affect my career, and I was very worried about how people would perceive me. And I remember, and just, I didn't feel like I could do it. So basically my brain injury rehab specialist said, you just need to go back to work. And he said, actually, the brain, the whole brain plasticity thing, you're not actually going to get better until you go back to work. And I was like, but I was working inside an SBS. I have to read really complex material and interview people about really complicated subjects. I can't even read a novel yet. How am I going to do that? And he was like, you just have to start. And he was so right, because I remember the first day, and I was given a story to work on, and I could literally just feel the sort of cogs turning in my brain. And it was like my brain was remembering how to do my job. So I guess, and the other thing is, he said, the specialist said, was just to fake it until you make it, basically. And I, just actually go in and don't tell people that you can't do it, and don't talk about your headache. Like, in certain professional situations, you know, it's like try and actually not make that part of your identity too much, because you can do it and you don't. And, you know, you've got to be, it's a fine line between not, you know, wanting to be, not feeling like you've got to cover things up, but also just not being seen and sort of labelled and misunderstood and things like that. And so I basically just pushed through, and, you know, I think my colleagues really had no idea. Well, I didn't say why I'd go for a walk to the park. You know, I'd just sort of disappear. I was like, oh, I've got a headache, I'm going off, you know. And eventually I recovered to the point where I could, you know, actually learn a whole new craft. I learned to make audio, you know, decided I wanted to make this Brain on Nature podcast so I could find out more about what was going on with my brain. I was still recovering while I made the podcast. And I remember going along to a podcast workshop to learn, and they were like, okay, tell us about your ideas. And I didn't want to tell anyone. There was only 10 people at this workshop, but I didn't want to say publicly about my brain injury. I like cornered one of the tutors and sort of told him this podcast I want to make. And I said, but you can't tell anyone, because I was so self-conscious about, it affected my career. I was really worried. And I still am, to be honest. Like I thought about coming on this panel, like, oh, I don't want, what if some, you know, it's this weird thing, even though I've made a whole podcast about it, it's like there's still the self-conscious thing. But I guess in terms of your question of someone who's going early career and I think is just believe in yourself, don't, you know, look after yourself, but don't feel like you need to tell everyone everything about it, you know, like you just, I think you can protect yourself a little bit by choosing who you share with, and giving yourself those breaks, you know, like breaks are good for everyone, but to, like, feel okay about taking breaks when you need to. And you know, other people go off and have coffees and do all sorts of things. Like it's okay to go for a walk to the park or meditate or whatever you need to do, take a sick day or whatever, because other people do things and you don't have to feel like you're sort of the odd one out, really, you know, just unbelievable. Yeah, I think just to, and then fake it until you make it.
And Carla, do you have any other questions?
Yes, we do. And just on the topic of breaks, I can't help myself. I have to jump in. When I used to, you know, when I had a career working in the city, I would go out and I would just see people smoking on the street, having a break. Smokers have the best deal ever. They go out and you get a break every hour or so, right? Like if you go in to meditate every hour, that would be far more productive. You'd come back, you know, and it just doesn't happen. And it's just such a, I mean, that's where we need to head, I think. And so we shouldn't feel guilty about taking regular breaks, because, you know, we see all the time things getting published about it being more effective and, you know, being more refreshed and focused. But I digress. Sorry, I couldn't help myself. We have a question, and this was coming back into the theme around acceptance and how acceptance doesn't necessarily mean giving up. And Nicola asked about how everyone stays so positive. And Katrina also said that she finds it hard to accept that she'll live in pain forever. Could the panel potentially talk about the process of this acceptance and staying positive?
Yeah, Gabriella, why don't you kick us off? You were talking a little bit about your journey to acceptance and how you feel like you're better at that now than you were when you were younger. How do you kind of manage that, or how did you get to that point?
A lot of years of suffering and struggling. I think the breakthrough moment was doing that pain management program at Ronald Shaw, because it really, I stopped catastrophizing, and I really changed the way I thought about the pain. So something that the early career question, I was thinking while you were talking, that don't let other people label you. You know, your migraine is a condition that you live with, but you are, you know, a beautiful person yourself, and they're two separate things. I know they intersect, but you've got to try and remain confident in yourself and not let other people's labels and eye rolling and, you know, sighs and all those sort of reactions that you get in the workplace. Don't let that affect you. So I guess in terms of acceptance, it's It's knowing that I have control to some extent over the migraine attacks, and it's just trying to accept. I think it was what Sarah said. It's like, okay, this is something that I have to live with for the rest of my life. I'm going to live the best life I can live despite the pain. I have to just accept that that there are going to be times when I'm not well, but there's a lot of people who are a lot less well. So I just try and rationalise it a little bit. And I think, as Sarah said, you've got to surround yourself with people who really care and who are empathetic, who don't treat you like an invalid, but also don't brush you off and get frustrated with you. And so I think it's an evolution of years and years, decades of struggle, and finally reaching a point where I feel much more relaxed about it. And I think by being much more relaxed about it, I probably have fewer migraines.
I've actually found the same thing. Like, ironically, I've found that with acceptance of my chronic pain has lessened. And in a similar way, I use an app called Curable, which that is a free plug for them. But they talk about very much what you've spoken about, Gabriella, how when you feel a migraine coming on, you might have things to do. In my case, I might have a big story I'm working on that I'm rolling out that day for TV or radio or digital, and the migraine starts to come on, and I think I can't deal with this. I've got too much to do, and then the migraine gets worse. And ironically, I found when the migraine comes on, and I'm not always good at this. Some days I still panic, some days I still catastrophize. But on the days where I can say, okay, it's happening, I'll deal with it. I've dealt with it before. If I'm too sick to work, I'm too sick to work. That kind of, can minimize the pain. And the science behind that is that when you panic, your amygdala sends out danger signals, and then your body interprets those danger signals as pain. There's no such thing as direct pain signals from your brain. They're interpreted. So that's definitely something that's really helped me. What about you, Sarah O? It sounds like some days, like me, you're all about the pain acceptance, and some days you're not at all.
Oh, absolutely. It is 100% day to day. And I would, I shouldn't be plugging my husband so much, but genuinely he has been instrumental in me helping me find ways to deal with it, because I'm notorious for going head on, ironic as that is, head on into life and into things. And often, if I've got a diagnosis, and, I think for the last few years, it's been a diagnosis after diagnosis. And, as it typically happens with chronic conditions, you start to uncover all these other things. And I'm just like, I was totally healthy before I had kids. What's going on? And, in absence of blaming my children, which I cannot do, the reality is, I think as busy human beings and particularly driven human beings, and, whatever type of personality, even if it is passionately advocating and giving yourself a routine and providing good self-care to yourself, you're still going to have a bad day. And I think on the worst days that I have, I find those moments where I kind of go, all right, I'm at that point where I just can't. I just gotta bail. So I clear my calendar for the afternoon, and I take away all that pressure, which ironically gives me, this pressure release in my brain, and I just lay down, and usually I'll talk to Luke, or I'll talk to Gracie, one of the kids, and I'll just engage with another human. Or I think being outside. We live by the beach, and for me, salty sea air is amazing. I know when it's going to rain. I know I don't know if anyone was around for the earth shaking that happened in Melbourne yesterday, but we got the aftershocks, and we're in hotel quarantine at the moment. But we got the aftershocks here in South Australia, and the whole building shook. But I knew that we were in an earthquake before it even happened, because my brain told me. I could feel the the vertigo before we even could feel the building swaying. So, you know, I feel like you end up in this hyper in tune state with yourself, which is a blessing and a curse. But the blessing side of it is on those bad days, being your own coach, and that's a really hard place to get to. I've not been great at that my whole life, but as I've gotten older, as I've had kids, that's helped, or talking to other women who have similar struggles. You know, I love working. I'm great at it, but I'm not really great at the rest of it. So, you know, I'm not great at having a chronic condition. I refuse to call myself disabled. I'm just like, no. Like I said, I fought it for a long time. It is disabling, but I'm still me, and I don't want to lose that. And I had the same thing when I had kids. So I feel like that transformation, that process of acceptance is ongoing and daily. And on those real bad days, having just someone else to talk to about it can go 1,000 ways. Honestly, Facebook groups. I've found the Facebook groups, like, no joke. So this is a bit of a plug for you, Carl, but I've found the groups where we can share our stories and genuinely, you know, I've learned stuff from the panel tonight. I'm like furiously writing that down on my phone in the background going, okay, right, I'm going to go give those things a go, because I'm the kind of person that spends hours and hours researching and trying to make links between conditions here and there, and, you know, trying to build those synapses to fire differently. I'm like, how much in control of this brain can I be? And in reality, I think, you know, that's great, but talking to other people that have the similar experience is probably just as good, really. I'm not a doctor.
No, it's definitely really helpful. Carl, how are we going for time? Do we have time for one more question?
We can do one more.
Okay, so quick one.
We've got Alyssa and Fiona that are both have questions relating to their doctor and neurologist. Alyssa had a bad experience with the doctor, and Fiona was asking about, how do you find a good doctor or neurologist to help?
Yeah, I think finding a good specialist is really difficult, and it's interesting that they're both women, I think, because women, many studies show that women are typically more dismissed for their pain than men. They'll wait longer at emergency departments than men, and they'll also be given less pain medication than men, even if they report having worse symptoms. So I've certainly experienced that, you know, even with my endometriosis. A specialist said periods are just painful. When I was vomiting, couldn't breathe from the pain, it was so excruciating, and it turned out that periods aren't just painful. I had stage 4 endometriosis. What about you, Gabriella? You've seen a lot of specialists. Have you how have you kind of managed to find a good one? For me, I don't tolerate being dismissed anymore. As soon as I see someone who dismisses me, I move on to the next. What's your strategy?
I think I've probably failed in many respects. And in fact, that's why I'm going to change neurologists. You get comfortable with the one person, but then when you see someone else who's so dynamic, you think, well, that I really want to be with that person, because maybe they're like me, they're a problem solver. And they can put together, they can see the big picture and all the little moving parts, and maybe together we can work something out. So it's a work in progress. The best person in terms of doctors was Professor Michael Cousins at the Pain Centre at Royal North Shore. He was absolutely the best doctor I've ever had, and empathetic, compassionate, kind, but right in touch with the latest research, because he was doing it himself. So I feel like on the neurologist side, I think I probably have failed, and I'm looking to make some changes there.
I don't think there's any such thing as failure in these cases. It's trial and error, as you said.
Trial and error, yeah.
Yeah. But yeah, I think I would really encourage people to effectively be heard by your doctor. If your doctor isn't listening to you, that is their job. Move on to another person. And I also think a lot of the time it's about chemistry. It's like dating. Sometimes you might see an incredibly competent specialist and they're just not a match. Just like sometimes you date a great person and they're just not a match. And so I'm a huge believer in doctor shopping. And not being afraid to break up with your doctor and move to the next one if they're not hearing you. We are out of time. That has flown by. I have 25 more questions for each of you, but that has gone so quickly. I really wanted to thank you all, Gabriella, Sarah O, Sarah A, for sharing your stories. I've also learned so much tonight, and I really appreciate it. And I'll hand back over to you, Carl.
Yes, I'll just echo your words. Thank you very much to the panel, to all three of you, and a special mention, obviously, to you, Stephanie, for hosting and moderating tonight. It's been a wonderful event. I think the audience has really appreciated the stories and hearing the raw truth, and that the fact that no one has this down pat. No one is perfect. We're all human. We have good days. We have bad days, and as Sarah O was saying, we crack on to the best that we can. So thank you very much. Tomorrow, we're going to do a bit of something different. We're going to be at noon with a headache specialist talking about altitude and atmospheric triggers, the highs and lows. I think the pun was intended by the expert. So if you are able to take a lunch break, don't feel guilty about it. And we look forward to seeing you then. But for now, thank you very much to everyone for joining. Thank you to our panel and to our host, and good night.
Good night.
Good night.
Thank you.
Bye.
See you later.